Good afternoon. Thank you for being with us today. And I'm thankful to have Lieutenant Governor McKee here with us in his leadership and Commerce Secretary Pryor. As I usually do, I'm going to start with an overview of our numbers. As has been the case for several weeks, our data continue to trend in a good direction. We had 416 new cases for yesterday, and that was out of 20,094 tests. That means we had a percent positivity of 2.1%. This continues to be very encouraging. It's exactly the direction we want to continue to go. Our weekly percent positive is down to 2.7% this week compared to 3.3% for the week before. And the positivity rate in almost every city and town in the state decreased over the last week. Our number of people currently hospitalized, 238, is half what it was at points in just December. However, we do sadly have 15 new COVID-19 associated fatalities to report. Our condolences and our prayers are with the families of these beloved Rhode Islanders who have passed. As he did last week, Secretary Pryor will provide an update on our current COVID-19 restrictions for businesses and other venues. These updates are based on the improving data situation I've outlined. Before he speaks, I do want to offer the same caution that I offered last week. We are in a calmer period right now. If we can remain in this calm period through the spring, that would be fantastic. However, we know that this could be a calm before the storm, and we need to be prepared for that. The biggest unknowns remain the new variants of COVID-19. We are monitoring for them. You've heard about the UK variant, the Brazilian variant, the South African variant. We are assessing through sequencing of samples and by tracking our own outbreaks in Rhode Island to see if any unusually large groups of cases are happening, which could be related to a more contagious strain of the virus. So those are the types of activities we are monitoring and watching for, and that will be an indication that the variants are becoming more predominant in Rhode Island. While we have not identified any of these new strains here yet, we have every expectation that we will confirm that they're here and that they likely already are here. It's really a matter of the amount of time it takes for it to start becoming predominant in what we're seeing, in outbreaks, in the spread, because the new variants are significantly more contagious than the current variants. The name of the game right now is to push them off. Do what we can to keep these new variants from increasing in proportion and becoming predominant. The more time that passes between now and when these strains, these new variant strains, are actively spreading in Rhode Island, the more time we have to vaccinate people, to help ensure that people are following the protective measures that we know can work effectively against the new strain, and the closer we will be to the spring and summer when it's easier to gather outdoors and to keep indoor spaces well ventilated by opening windows and opening doors. Last week, I talked about improving indoor air quality and the need for ventilation to be as good as possible in indoor locations. We're exploring options on how to support businesses and other organizations in that area in similar ways that we have done with our school community. I also talked last week about minimizing how long you stay in an indoor place unless you work there or you live there. That's an important piece as well, particularly if it's an indoor place that's closed with poor ventilation. The longer you stay in that type of setting, the higher the risk of spread, particularly with a virus that is significantly more contagious. And finally, as a reminder of last week, I spoke about mask quality. You want your mask to fit snugly but comfortably, covering your nose, mouth, and chin without any gaps. Cloth masks are good, but the best kinds of masks, particularly in advance of preparing for new variant strains of COVID-19, are KN95 masks, KF94 masks, N95 masks, or medical procedure masks, which are paper masks. Those are also good as well. Starting next week, we're going to be distributing KN95 masks at testing sites. We will eventually have these high-quality KN95 masks at all testing sites. We want to help make sure that everyone has access to the types of masks that we know are continuing to be increasingly effective. If you get tested once a week, you can get a new high-quality mask as you need it when you go. If you don't have one of these masks, make sure that your cloth mask is made of a tightly woven, breathable fabric and is 2 layers thick. And again, you want it to fit as snugly as possible. So do what you can to get access to the higher grade masks, and then make sure no matter what you have, that you're wearing it in the most effective way possible. While all of this is critical, we also recognize that if we have a window when we're able to give our business communities and all Rhode Islanders some relief, we want to be able to do that. We can do that carefully. We also have to know if we go too far, the risk of the new variants spreading sooner could increase. So we want to be careful, but also take into account what's needed to support our businesses. Also want to acknowledge what's needed just to support each of us, knowing the challenge that we've had to face over the last several months. So for example, what we are going to do is change the social gathering size in Rhode Island. For several months, we have been directing everyone to just socialize with the people in your household. The social gathering size was limited to the people that you live with. As of tomorrow, the social gathering size will be 2 households for gathering indoors and 3 households for gatherings that are outdoors. That means that the people in your household should only be socializing with people in one other household indoors. You should think about those 2 households as 2 exclusive units together. It is also important to continue to wear a mask when you're gathering with those individuals, but we want to encourage this extent of socializing. For socializing that happens outdoors, your household can socialize with 2 other households for a total of 3 households together. Hopefully, with the weather going in the direction we want it to, there will be more opportunities to be able to do that. Separately, I want to provide an update on our vaccination campaign. To date, 133,844 doses have been administered in Rhode Island. That's 93,489 first doses and 40,355 second doses. To this point, we have been very targeted in who we are vaccinating. During the first portion of the vaccination campaign, we were largely focusing on healthcare workers, people in public safety, and residents in congregate settings. We are already starting to see results. We know in being very targeted, we're going to minimize waste of any vaccine, and we're going to make sure that the individuals that are at highest risk get access to it, and have the greatest impact we need to protect our healthcare system capacity. So even if that takes time, it has really been about the quality of the individuals that we have focused on vaccinating. If you can display the slide with our healthcare workers' cases on the screen, you can all see a precipitous decline in cases among healthcare workers since we started vaccinating, focusing on them. While our case rate decreased statewide during this period, our case rate among healthcare workers has plummeted in a very good way. We've also seen great results in our long-term care facilities. This is encouraging news. We have a vaccine that we know works. We don't have a lot of it, but for that reason, we are being very targeted, more targeted than many other states in who we are vaccinating, particularly during this first portion of the vaccination campaign. And as I've said, who you vaccinate matters. The message for you is that it's working. Our early approach to vaccinating is allowing us to preserve our healthcare system and is protecting residents in our nursing homes and assisted living facility. Those precious individuals who have been at highest risk of hospitalization or fatality. As we look to the next portion of our vaccination campaign, we will be focused more on the general public. There are 3 main locations where people are going to be vaccinated. I talked about this where last week. The first is a retail pharmacy. The second is a local or regional vaccination site. And the third is a state-run vaccination site. This week, CVS and Walgreens, for our retail pharmacy approach, will be getting 7,000 doses for people 75 years of age and older. They're each getting 2,000 doses from our federal allocation, and CVS is getting an additional 3,000 doses directly from the federal government. This is a continuation of the vaccinating of older adults that the pharmacies have been doing for several weeks now in other settings. For the local or regional clinics, those will be restarting next week. The cities and towns will be getting 7,800 doses each week for the next 4 weeks for people 75 and older. That is 7,800 doses total, not 7,800 doses for each city and town. Vaccination clinics are going to be running in cities and towns, at schools, at senior centers, and other sites for first doses over the next month, starting next Wednesday. Our cities and towns have been excellent partners for supporting our seniors and helping to ensure that regardless of their access, their understanding of the registration process, or ability to get to the site to get vaccinated, they have worked hard to make sure that our seniors 75 and older have access to the vaccination that's needed. The clinics that will be continuing with our cities and towns are registration only. You cannot walk up and get vaccinated. You need an appointment at a particular time, and you only need to show up exactly when that time is there. There isn't any need to show up earlier in order to miss running out of vaccines. We've worked hard to ensure that if you have an appointment, there's a vaccine ready for you at the time the appointment has been set up. Appointments are being handled by cities and towns. For people who make appointments with these local clinics, remember, show up at the assigned times. Appointments have been spaced out so that we can avoid crowding. We do not want people in crowds and do not want people standing in lines in the cold. If you have registered, there is a dose for you. You do not need to worry about the clinic running out of vaccine. And finally, our third where is our state-run vaccination site. These are the last types of sites where vaccinating will be happening. Next Thursday, we will open a state-run vaccination site at the Dunkin' Donuts Center in Providence for people 75 years of age and older, and our Sockanosset Crossroad vaccination site in Cranston will open for people who are 75 years of age and older as well. For the last several weeks, healthcare providers have been getting vaccinated at Sockanosset Crossroad, and we're going to start doing some healthcare providers at the Dunk over the next few days, which will help us plan for the big launch on Thursday. Our goal with our state-run vaccination site is volume. We will have the capacity to vaccinate hundreds of individuals per hour through those sites. We will be doing roughly 500 doses per day at the Dunkin' Donuts Center to start with the public, and roughly 900 doses per day at Sockanosset to start. As more vaccine becomes available, we will expand capacity, and we will open eligibility to additional groups beyond people 75 years of age and older. This is very exciting news. While a lot of our other vaccination venues are more targeted, these state-run sites are the places where we will be doing our greatest volume of vaccinating. Like the city and town clinics, you need to register for these state-run sites. You cannot walk in without an appointment and get vaccinated. Next Wednesday, we will announce the registration link for people who are 75 years of age and older for these 2 additional state-run sites. We will also announce a phone number that people can call to make an appointment if that is their preferred method. People will be able to start registering on Wednesday for appointments starting Thursday, and on Wednesday, 2 weeks of appointments will open up at that time. I want to reiterate that not everyone 75 years of age and older who goes online or calls to make an appointment will get an appointment right away. There is still more demand than supply right at this time. We understand that people are frustrated by that. We are frustrated too. We wish more vaccine was coming into Rhode Island. We're doing everything we can to help make that happen with our federal partners. And we will get to the point where everyone who wants to get vaccinated can get vaccinated. Until then, we're asking you for your patience for a little while longer as we continue to focus on the most vulnerable to keep them out of the hospital and to keep them alive. Before wrapping up and handing it off to our Lieutenant Governor, I'll make 1 point on testing and 1 point on treatment, as I always do. It's all about testing, treatment, and vaccinations to get us through the remainder of this. While the testing site at the Dunk closed last week, we have opened a new testing site in downtown Providence at 79 Dorrance Street. This site has Binax tests, rapid tests with the same setup of results within 15 minutes. This is a walk-up site as well to increase accessibility. For most of our other 35 sites, you can make an appointment at portal.ri.gov to get tested. There are free same-day test appointments available. With the more contagious variants already present in the US, testing is more important than ever. It's a great thing that Rhode Island is leading the nation in testing. As I said last week, everyone should consider getting tested every week, especially if you're out in the community a lot. And lastly, treatment. Get educated about treatment at covid.ri.gov/treatment. You should especially do that if you are 65 years of age and older, or if you have an underlying health condition. Because if you were to test positive for COVID-19 and have symptoms, those who are 65 years of age and older or have an underlying health condition qualify to get treatment that works to keep people out of the hospital. Vaccine is great. We want everyone to get vaccinated, but until we have enough vaccine for everyone, We need people to be taking advantage of the testing and the treatments that are available. Treatment is extremely effective, and it's available even if you don't have a doctor. Again, for more information, go to covid.ri.gov/treatment. And with that, I'm going to pass things to our Lieutenant Governor McKee.
Thank you, Doctor, and good afternoon, everyone. As you just heard, the numbers are moving in the right direction, and we should feel good about that. But we also should be very aware of the strain that potentially could be coming our way, so that reinforces the need to be wearing our masks and following the protocols that are going to keep everybody safe. Our goal continues to be keeping people safe and out of the hospital. But we also are beginning to identify ways that we can provide our local businesses with incremental flexibility without increasing the infection rate, our hospitalization rate, or our mortality rate. You've seen the beginning of that incremental effort over the last week, and we expect that to continue in a way that keeps everyone safe. I want Rhode Islanders to know that our transition continues to be wholly focused on the COVID-19 response and vaccine rollout. We are working what seems to be around the clock. Our priority is getting shots into the arms as quickly and safely as possible. And our team continues to work closely with the state COVID response team, and I'm meeting with Dr. Alexander Scott and General Callahan every single day to ensure we're on track and that I have full understanding of what our team is doing in the state so we can hit the ground running day one when I become governor. Yesterday, Dr. Alexander Scott and the General joined me at a meeting of my transition COVID advisors, a team of national and local leaders who will advise me on my transition on the state's pandemic response and vaccine rollout, particularly as it relates to vaccine distribution and building capacity at the municipal level. It was a great, informative meeting. It was open to the media, and I thank everyone who is volunteering their time on that group of advisors to serve and to share their perspective and expertise with me. Yesterday, I was at another call on the White House with governors around the country to discuss the vaccine rollout. Connecting with and learning from our other states is critical important to me as we move forward. Over the weekend, I had the opportunity to tour operations in Central Falls, at Central Falls High School Vaccine Clinic with Mayor Maria Rivera, and I was impressed with the community engagement they've been able to build around their vaccination effort. So in the weeks ahead, I think what we're seeing that municipalities can and will play an instrumental role in getting as much vaccine shots into the arms of the people who live in our 39 cities and towns. Again, this week I convened 2 meetings with Dr. Nicole Alexander Scott, along with the team that's working with her and municipal leaders from across the state to discuss the vaccine rollout at the local level. Keeping the information and input flowing both ways between state and our municipalities, I believe, is a key and effective vaccine rollout strategy. This work will continue, and I will engage all our municipal leaders in a way that shares their feedback and the state shares information that is critical to all 39 cities and towns, and asking that for input to help us execute a plan that gets shots in arms as quickly and safely as possible. That's the end of my comments. I'll be here to answer questions, but I'd like to hand this over to Secretary Pryor.
Thank you, Governor McKee. Very much appreciate the opportunity to address this group. And Dr. Alexander Scott, thank you for your continuing leadership and partnership. I would ask that you display the new slide displaying the restrictions and new flexibility regarding the restrictions. We are very pleased that today we are able to offer yet more flexibility to businesses in Rhode Island. The improving public health conditions enable us to do so. It requires a lot of consultation with businesses and business organizations. We're grateful to them. I want to thank the outgoing governor and the incoming governor for their attention to these new flexibilities, for their encouragement, and to Dr. Alexander Scott and her team for working through these possibilities and making them a reality. It is hard work. It's hard work on the part of the businesses and their associations and the governmental team, but both the outgoing and incoming governor are focused upon it. It's working, and we are providing for this further easing for small businesses and all businesses in our economy. We know that especially small businesses are affected, so we are in fact focused in a laser-like fashion on assisting them. So as you see on the screen, as Dr. Alexander Scott has outlined, there is first and foremost the change in the social gathering size. She ably outlined the shift to 2 households indoors, 3 households outdoors. We already made that change in restaurants, and that change is a continuing one. That restriction set of parameters continues. We are focused on what we can do also for 2 categories you see displayed: venues of assembly inclusive of houses of worship, and bars and bar areas within restaurants. So I'm going to talk about those today. We are going to start with the changes to the venues of assembly. For venues of assembly, including houses of worship, we are going to open up from 25% capacity to 40% of capacity with a cap of 125 people in the facility. As a reminder, venues of assembly as a category includes places like performing arts, movie theaters, churches, synagogues, and mosques. So in settings where there is structured seating in an auditorium-like venue, there will be now 40% capacity. For those houses of worship that have significantly greater capacity and where 6-foot spacing may be maintained within that greater capacity, for such houses of worship, there is an exceptions process to go larger than the 125 through the Department of Business Regulation if that is necessary. Let me emphasize what Dr. Alexander Scott correctly always does, which is that it's still safest to stay smaller, and it is still altogether safest to go remote for performances or for worship services. So we ask if that is possible for you, and if that is your preference, as a venue, as an organization, as a congregation, as a parish, please do continue to do so. But we're also pleased that we're able to offer this flexibility if gathering in person is a priority for you. And we're very grateful to the outgoing and incoming governor for enabling that. On bars and bar areas, a couple of things before I get into the new flexibility. Please be reminded that bars in Rhode Island must operate akin to restaurants. Operating like a restaurant means that there is no standing service, there's no congregating, it's seated service only, and it needs to be spacing or barriers between customers in order for the establishment to operate safely. Now I'm going to get into the details of that. At the bar, if parties wish to sit at the bar, they are limited to 4 people or less, with no more than 2 households per party. There is a spacing requirement. The standard spacing requirement, of course, is 6 feet between parties, including at the bar. If an establishment has invested in plexiglass or another impermeable barrier between customers, the new rule is 3 feet may be provided between parties if that plexiglass is in use at that bar. I want to thank all involved in helping to arrive at those changes, which were carefully considered. It's also the case that we're introducing a new rule pertaining to length of stay at the bar or bar area, which is a 90-minute rule. That is to say that a reservation may only be up to 90 minutes total. A seating may not exceed 90 minutes. And we are returning only for bars and bar areas to an early closure scenario. And that early closure time is 11 p.m. 11 p.m., as you may recall, is the early closure time that preceded the restrictions that were undone with restaurants that recently reopened. That was the original early closure time. So that early closure time has been reinstated. I say all this to say that this combination of parameters is being utilized to enable bars to reopen. It's worth noting that multiple states in the region have not yet reopened bars at all, and that includes Massachusetts. Massachusetts has not reopened bars. We're grateful that yet again, Rhode Island is at the leading edge of introducing rules that make sense. We wish we had no limits or parameters, but rules that make sense to keep people safe, and we are at the leading edge of reopening for the sake of our economy. So we are, once again, very grateful to our outgoing and incoming governor for providing the room for us to undertake these changes. It's so important that we continue to consult with business organizations, list out those changes that are possible, compile the public health data, and take those steps that we can when we can. Lieutenant Governor McKee has brought enormous energy to this process, and Governor Raimondo remains very, very committed to it. In partnership, we're making this happen. I want to specifically, as a final note, thank on the restaurant front. I want to thank those members of the Hospitality Association, the Ocean State Coalition, and the Small Business Coalition, who have night and day been consulting with us to enable the changes on the bar front. Thank you very much. That concludes, and Dr. Alexander Scott, I don't know if you want to resume the podium, but with Governor McKee, we can start to take questions.
Doctor, why isn't there one place for people to call or sign up for a vaccine, right? You announced the state-run sites, there'll be a phone number and a website for that. The pharmacies have their own system. The cities and towns have their own system, and there's dozens of those among the cities and towns. Why not just streamline it into one place people can call so they don't have to sign up at multiple places like you said last week and try to navigate all this themselves and get some help, especially the elderly?
That's an excellent question. For right now, we want to make sure that accessibility is the focus, particularly for our seniors. And so being able to reach out to your retail pharmacy is something that people are familiar with. If they need to get a flu vaccine at CVS or Walgreens, they would follow the same process to go ahead and get a COVID vaccine there. So the retail pharmacy piece is distinct. For our focus right now on the 75-year-olds and older, we do have a variety of approaches, and it's really a credit to our cities and towns who are actually doing the registering for our seniors in many situations, taking the time to do that. So we are continuing that type of approach there, and then those seniors who will be able can go ahead and do the state run where we'll have more volume going through. As we move forward and start to extend out into further groups within phase 2, we will work towards a more focused approach across all of our government interfaces. But for right now, want to keep it local and knowing how much the cities and towns are doing for the seniors to make it as easy as possible for them.
Do you know yet a percentage of how many of those 75 plus population have tried to sign up or are waiting to get a vaccine, and how many actually have at this point?
Yeah, through our cities and towns, they are pushing out all of the vaccine that they have access to, and have really been providing the true supportive services for our seniors that we want. So I'm confident that the additional 7,000 plus that we will be pushing through cities and towns are going to get to every senior in their local community that they are reaching out to.
Do they have different channels of access to vaccine at the city and town levels than you do at the state level? Why this disparity between cities and towns, states, pharmacies? Why this disparity?
So this is not at all a difference or the term that you're using. The oversight of it is not that. The oversight of our distribution of vaccine is fully controlled through the state. It's really a true form of equity in terms of making sure that those who need to have the particular access are doing it. And I'll again, thank our cities and towns that are doing a great job registering for seniors and really helping the support make sure they get it. And the vaccine supply that they're getting are coming from us.
The philosophical underpinning to that.
To help make sure that seniors have the access they need. To help make sure that seniors have the access they need. Good afternoon.
Massachusetts announced that they're going to allow caretakers who are taking the older people to be able to get vaccinated. It seems a little bit more streamlined. Is Rhode Island going to follow suit on that?
At this point, we are focusing on the seniors. I do appreciate that approach, but with our limited supply, particularly given that we historically had even a smaller amount to get to the public, we wanted to continue to focus on the seniors themselves. As we start to get more supply, we will look forward to having more creative access for additional members as well.
A lot of email about nursing homes. And given the fact that everybody's been vaccinated and the front care workers, have you had any outbreaks at the nursing homes?
The cases have decreased.
They want to know, loosening up, visitation and all of that a lot of these seniors literally are dying of loneliness. It seems there's a lot of CYA on the nursing home owners, that unless you bring the hammer down on them, they're taking the path of least resistance. Oh, we really don't want to, get in trouble and all of that. So again, what directive and discussions have you had from the Department of Health telling the nursing home facilities you really need to start loosening things up, given that you follow the science and the data, and that seems to be trending in a positive direction?
Absolutely. We have had in place the caretaker approach and the other strategies to help address the importance of seniors being able to have the visitors, and have really pushed that with our nursing homes. Now that we are coming on to the final parts of the vaccination process with our long-term care facility, there's still some more facilities that need to be included. It is the right time to start engaging further about how to more systematically expand the visitation restrictions.
One more quick question. Are you using the field hospitals at all right now?
Somewhat, to a lower extent.
And then when the hospital, it looks like the hospital count is way down.
Yeah, it is a very minimal number. We are working closely with the hospitals on when they may actually need to. But we also are really focusing on preparing for what could happen with the variants coming and understanding how soon that could be. We're doing our best to try to push that out while providing for the business support that Secretary Pryor discussed earlier.
Once we've heard about, for almost a year, we've heard about bars being amongst the most dangerous places when it comes to COVID-19. So now we're reopening here just as we hit a low weekly percentage. So who exactly, from a scientific, not a commerce or industrial standpoint, but from a scientific medical standpoint, sat around the table and came up with these decisions as far as the reopening? I mean, I'm already getting at least a dozen messages from people who work in restaurant or bar environments that are saying, now I'm scared to go back to work.
Yeah, these are very tough decisions. And from a public health standpoint and partnership with our commerce colleagues, we constantly have to balance. Public health includes health and healthcare, and it also includes our economic health. So really being able to assess where we are with our data, People have done a great job in getting our percent positivity down. And then also, as you can see from our loosening of the restrictions with bars, how still extremely cautious we are in making sure that tables are still 6 feet apart, in making sure that it's still seating, dining services in place, and making sure that there's a limitation on the time frame to 90 minutes or less, as well as working with businesses on improving ventilation. We want to do everything we can to avoid it being a super spreader event. There's no mingling, there's no standing at the bar. The plexiglass is still there in between that and the bartender. So it's really being thoughtful. It's hard, to take that approach, but we also understand what our business community has been experiencing and want to continue to find that balance with the expectation that as soon as we see spread of cases, increased outbreaks, evidence that we have a more contagious virus in place, we absolutely have to close this.
Medical experts by name or organization have signed off on this plan that are not inside the Department of Health. Who have you said that there was a consultation that took place to arrive at this. We've heard the Ocean State Coalition, et cetera. But did someone from Brown University, did anybody who's conducted a study in a medical perspective say that this was a good move?
Yeah, our approach all along has recognized that the data and science has to be balanced with what we are facing. We have public health advisors that we engage with and have throughout this event and have appreciated their input. And at the end of the day, with the governors, we've needed to make the decision that's best. With all of the cautionary steps that I have expressed that are in place and the clear understanding that were we to start seeing increases in cases and we would need to pull this back, this has been something, this has been the path and the direction that we've taken temporarily for now.
As currently constituted beginning on the 12th, theoretically, somebody could have a concert at a bar on the 12th. You could have people gathering around the bar, performance. Is that something that's medically acceptable if that's the case for that to take place? Is that what you're saying?
No, our requirements with these restrictions continue to be seated. It's similar to what's happening in the restaurant dining area. There continues to need to be spacing in place. The limitation on timing is a new component we're adding. The ventilation guidance is a new component that we're going to be pushing. So we absolutely are doing this carefully, supporting the businesses, but doing it in a way that minimizes the real risk when congregating indoors with inconsistent groups happen. We absolutely want to avoid that.
Oversight on this.
We have that oversight.
Doctor, I have a question for Governor McKee. If you could come up to the podium. Governor, Rhode Island has lagged other states in delivering the COVID shots. Through Monday, we had the 4th lowest share, population vaccinated, 8%, according to the New York Times. We were dead last among states in percentage of vaccine doses used. Governor Raimondo the other day mentioned that there was some kinks in dealing with CVS and Walgreens. In layman's terms, are you familiar with what those kinks are? And if you could explain to Rhode Islanders what's being done to rectify it.
Yeah, so there's national agreements in terms of the way that the pharmacies are working, and that the states that are, made arrangements with the pharmacies, which Rhode Island was one, are lagging. But I see that the work that's being done now is going to accelerate that. And just like the testing, when the testing was lagging and the state organized and then launched it, and now we're number 1 in testing, my anticipation with bringing the municipalities in, the state sites, and then working directly with the pharmacies, that those figures are going to change very dramatically and very quickly.
Governor Raimondo mentioned she contacted a CVS executive over the weekend. Were you aware that it had reached that point? Had you thought of injecting yourself, or is this still your restrained from doing that because of the current situation.
Yeah, the governor, I know, and informed me that that contact was going to be made, and I also informed her that we were going through our channels nationally to do the same thing.
That Rhode Island will move from being dead last with the percentage of vaccines used?
I think the plans that we have in place right now, bringing the municipalities in, setting up the state sites and like starting at the Dunkin' Donuts Center, and then along with the pharmacies, I think that you're going to see a rapid increase. And also remember, we vaccinated certain specific types of individuals, and now when we're rolling into the age groups, you're going to see that that's going to flow pretty quickly, and then we're going to get into the 65 and older at the appropriate time. I think that's a few weeks down the line. But when that happens, you're going to see the state really functioning the same way it did on the testing.
Dr. Nicole Alexander Scott, I have a question for you. With February break starting Monday for school and potential for travel, is there any indication as of now that the Department of Health will require school districts to implement a quarantine after the break?
No, at this point, we are continuing to work with our school community to make sure that the testing services that are available and access to all of the resources with our Education Operations Center will continue and make that available for the school community as well.
Governor McKee. Excuse me, Craig. Despite a $1 billion plus cash infusion by the federal government, clearly not enough has been done to provide for small business. In one case, which I document on our website, a check for $250 for a single location of a multi-unit chain restaurant. In a case overall of $20,000 was received for a business that realized a loss in sales of over $2 million. Meanwhile, Commerce Corporation recently announced the creation of a $36 million loan to what is now referred to as #38soccer, aka Tidewater Landing, for the benefit of developer Florida partners. My question, given the ease or the relative ease at which the availability of this credit line was generated and its generous repayment terms, will the government of Rhode Island create a $50 million line of credit to support the existing locally based business community with similar repayment terms? Sales tax collected by these businesses will be used to repay their credit lines.
Yeah, so you're not telling me anything we don't know, right? We know that the small businesses needed more of the CARES Act dollars, and I intend to do a review of how the CARES Act dollars were spent and then appropriate the funds, so those funds to the businesses in the form of grants. I've also been on the record to talk about that the small businesses need a long-term strategy in terms of a loan program. So we intend to bring all the CEOs of banks together along with the SBA to talk about a state guaranteed and a SBA guaranteed loan program like you're talking about. So, and then the other thing, while I got the attention of the small businesses out there, that thank you for doing that, is that the PPP loans are critical. So right now we're approaching over $800 million of PP loans that have gone out. That's the SBA program, right? The payroll protection plan, a plan for the small business. We need to drive that up to $2 billion or more like we approached in the first round, and we can do that. But every business out there that qualifies, we want you to apply for that PPP loans. That's going to bring significant, far more resources than what we can put on in terms of the CARES Act. We're talking about billions of dollars there. We're talking about tens of millions of dollars in the other place. So,
respectfully, and you've been on the forefront of this to your eternal credit. Right? We're talking about a government that right now, and we've had 8 or 9 months to talk about this, think about this. We've had 8 or 9 months to create a plan. And yet, seemingly, without any hesitation, the state's willing to offer $36 million now to fortuitous partners, with nearly sales tax being the repayment for it. So where's the justice in that?
We're going to talk about COVID right now, but I'd be happy to follow up because you and I have disagreed on this for a long time. The two separate issues, and the small businesses are absolutely a priority in my new administration, and it will continue to be as it has been in the past.
Regular Rhode Island businesses don't.
My question's for the doctor. You said last week that the restrictions could be temporary on businesses. I'm wondering what the threshold is that you're using for, we have hit this percent positive for us to start cracking down on restrictions. Can you share exactly what it has to look like here in the state to do that?
It's essentially what the trends of our cases, our percent positive, our hospitalizations, and our overall outbreak response will show. If we start to see indicators that reflect a more contagious virus being present, clusters of cases, outbreaks occurring, that in addition to identification of the virus, the variant strains via the sequencing that we're doing, all would be support for showing it's going in the wrong direction and we need to make an adjustment. It allows us to talk about why testing is important, treatment is important, as well as the vaccination.
One quick question in terms of limitation of timing at the bars, is that new? Is that what you said? That's a new thing? And do patrons have to order food at the bar to be there like they once had to?
It is restaurant style dining only at the bar, so they should be eating.
Thank you, everyone.